actually this week.
Sorry.
Sorry. If you haven't yet, please go check out the schedule. There is an event for everyone: startup founders, technologists, innovators, educators. And it is an opportunity to find resources and make new connections to drive forward your organizations. Now, there are some premier events happening. Tonight is Meet the Meetups. And then later throughout the week, we have Reverse Pitch to create the next innovation, the VC and Startup Showcase on Thursday, Health Tech Pitch event, Crypto and Coffee, and a lot of many more big events. This week is sponsored by the Milwaukee Tech Hub Coalition, which is a nonprofit focused on inclusively doubling tech talent in the region in order to drive enduring economic prosperity and create life-changing jobs. Over 100 organizations are working together to drive forward this mission. To learn more, you can go to mketech.org. And also, we just want to thank our MKE Tech Week premier sponsors, Hush Blackwell and Northwestern Mutual, and all of our sponsors for making this week possible. Thanks to the Wisconsin Startup Coalition for powering this week on behalf of the Milwaukee Tech Hub Coalition as well. And with that, I will turn it back over to Mike.
Okay, thanks, Ann. So as I mentioned, I'm Mike Harrison. I'm with HealthTechMKE. So HealthTechMKE is an initiative of BioForward. BioForward is a statewide nonprofit that's focused on supporting the state's robust and comprehensive biohealth cluster. So we have over 200 members in the fields of biopharma, biomanufacturing, medical device and diagnostics, healthcare innovation, healthcare research organizations, and digital health. HealthTechMKE is an initiative of BioForward that's focused on specifically supporting the health tech entrepreneurs here in the Milwaukee region. If you want to know more about HealthTechMKE, you can go to healthtechmke.org, and you can find events, all the startups that we've identified in the region, and resources. So please go by and check it out. HealthTechMKE also is involved in a couple more events throughout the week. So go to our events page on our website, and you can check them all out. So in working with a lot of health tech startups, one of the things that I get asked almost constantly is, how do we engage with healthcare systems? That's usually one of the number one questions, and I don't have great answers for that. I mean, there are events specifically happening this week that can assist in that. There's a Reverse Pitch. The Medical College of Wisconsin has an event on partnering with the college, but most of the time it's really tricky, especially if you're just a person with an idea. So I was really excited to learn about this great resource that is not only nationwide, but we have a center right here in the Milwaukee area. So, this is a way for you to connect locally, but also with the largest healthcare system in the world, in the United States. So we're going to learn today how they use their resources to spark innovation, and how you might be able to work with them in the future. If you do have questions during this session, please put them in the chat. And if you did want to speak directly with someone, you can save your question until the end. We'll have some time for Q&A at the end. We also have some guests that will be coming in from the greater VHA Innovation Network, and they'll be here to answer your questions as well. So I see Catherine Beckner is here. She is the Innovation Program Coordinator at the Central Virginia VA Healthcare System. And I don't know if she's here yet, but Suzanne Shirley, who is a Director of Community Engagement and Fellowship at the VHA Innovation Ecosystem. And then Ann Lord Bailey will also be joining, who is a emerging tech clinical specialist at the U.S. Department of Veterans Affairs. And our main speaker today is from right here in Milwaukee, Eric Ayala. who is an innovation specialist at the Clement J. Zablocki VA Medical Center. Eric, you can take it away.
Sure. Thank you, Mike. Let me have to do the logistics of getting the screen shared here. Well, while I'm doing this, my name is Eric Ayala. My roots in Milwaukee go all the way back to 1995 to 99 when I was a Marquette alum. And that's how I got established here. It's where I met my wife. And we're happy that we were able to return to Milwaukee in 2018 for my job here at the Milwaukee VA. Okay. So where we're looking to go today is a brief overview of how Milwaukee is a participant in a very distinct group, a subset of the VA hospitals around the country. So just to give a little orientation, VHA, you might know us as VA, but the VA is a department in the government, just like the Department of Defense has the Department of the Air Force, Department of the Navy, Department of the Army. The VA also has 3 departments. So they have where I work and where everyone in this Innovators Network is set is the VHA, that's Veterans Healthcare Administration. So they clearly take care of the hospitals and that kind of item. There's also the Veterans Benefits Association, Veterans Benefits Administration. That is a completely separate department, and their primary mission is to get active duty service members that are transitioning out of the military and making sure that they manage all their benefits, including not only healthcare, but things like VA loans for houses, loans for education, and benefits for education. So that's what VBA does. And the last one is National Cemetery Administration, and NCA, and that is a separate department of the VA that manages just the cemeteries and the burial rights and honors that veterans are entitled to. So just to give you, when we say VHA, it's still VA, it's just a sub-department that's focused on health. So I'm going to give you a brief overview of a little bit of what the Innovators Network is, and then we're going to have some question and answer time with my colleagues that have experience working with startups and partnering between startups and the VA. And I'll introduce them right before we ask questions. So a little bit about myself. I am a proud Navy veteran. I'm a submarine veteran, actually. So that's that picture. I'm an Army brat. So I went Navy. My dad was actually Air Force enlisted and then was commissioned in the Army. So that's the life I grew up on. I'm also a proud business badger. That's something that I just recently accomplished, getting my MBA at University of Wisconsin in Madison back in 2020 during COVID. And what you see is my family here, my wife, my daughter, and my son, and my father. My parents live up in Alaska, and that's where I grew up. So it's kind of a neat factoid about me. So we visited this summer and got to do a horseback ride. We don't own horses in Alaska, personally. Okay, you might not be aware, but the size of the VA, we have over 150 individual groups or individual facilities. The Innovators Network is a subset that it's competitive to join. And we have 32 sites, and it might be up to 34. Sometimes there's some flux because some sites might leave, but you have to apply and be accepted to be part of this. And Milwaukee has been one of the founding sites. We started in 2015 as one of the original innovation sites as they stood this up, they stood up the network. So here's a brief overview of the network. And please give me a thumbs up, someone, that you can hear it.
As healthcare continues to evolve and advance at the pace at which it's advancing, keeping up with emerging technologies, keeping up with disruptive innovation, I'll call it, is challenging. I think we have to defer to the individuals on the front lines, to the surgeons, to the clerks who are scheduling people, to see and recognize they're the ones best positioned to solve challenges because they see them every single day.
So the Innovators Network is needed sort of in the grand scheme to help people really build that energy and enthusiasm and that grit. We embrace the wild ideas and the potentially unthinkable.
We very firmly believe that the best solutions for veterans are going to come from VHA employees. who have the problems in their face every day. We also really tailor their training and the programming to empower employees, to give them new tools and build this little innovation army that then takes those tools back and keeps using them throughout their career.
The role of an innovation specialist is to work with frontline employees to identify, test, and potentially spread innovative practices, products and practices throughout the VA. What's great about Spark Seed Spread is that I find it's a way to get your ideas heard, to test them, and to be a part of the future of VA.
I think that the ones that are the most interesting are the ones that seem to be creating something from thin air. A nurse from Boston can just see a problem and be like, I don't have the right blood pressure cuff for this veteran. It doesn't exist. And she's like, I'm gonna make one. That's exactly what she did. And she created a prototype, and now she's gonna test it.
The space that we play in is not the same as meeting your performance metrics and doing everything better, faster, cheaper. We're looking at building out and closing that possibility gap.
We define our success in the number of lives saved and changed, which means that if I have one innovation that solved a problem for one veteran, that one life changed is success.
I thought that was better done than I could have spoken. Key to understand is this: in 2015, we stood up the Innovators Network because we wanted to change the DNA of what the VA is. We didn't want us to be understood as just your grandfather's VA. We saw an opportunity to change the culture and to adopt entrepreneurial and startup mentality, and to breed entrepreneurs within our organization to anticipate challenges. So we have some core values. The ones that I find most applicable to this audience would be that innovation is the most effective when it is born of diverse perspectives. It is most valuable when it's shared, and that we are veteran-centered. The network started, again, internally looking first to say, hey, how can we change from the stereotype of a stoic federal worker and build within the organization these competencies of an entrepreneur. And so that Spark Seed Spread is our internal accelerator for employees that allows them to come up with ideas. And we have special partnerships with the legal side of the VA to help with intellectual property and licensing, and commercialization. And so that's how we got to this point. So in the last year or so, last couple of years, we've always had partnerships, but now we've more formally tried to understand how can we leverage that relationship we have with the national offices for commercialization and intellectual property, so we can partner with startups, so that we're not the ones that have to come up with all the ideas. So I think that's what might be appealing to you, and I hope that's probably why you're here. So our goals are to build an innovative culture, develop innovation as a competency, and empower employees. We have some fundamental philosophies that we fall back on. Like our big framing of where we sit in the VA is framed by VJ's the 3-box solution. And then some of the core competencies we promote within the organization are problem framing, human-centered design, and then lean startup. So our accelerator does actually coach staff members through creating a business canvas and value proposition canvas. And then some skills that we promote frequently and that we're always refining are pitching and storytelling. And that's something unique really to what we do in the VA, as opposed to some of the Lean Six Sigma work that does happen throughout the organization as well. So our broad framing of where we sit in the organization is understood by these 3 boxes that currently in box 1, the VA has to fulfill its mission. It has to take care of veterans. It has to provide good quality care to them. Like, that can't stop. That is our mandate. And so what we currently do, we have to continue that. But we do see that there needs to be an opportunity to anticipate the future, anticipate changes coming down the line, and integrate those into our organization so we don't get left behind, so that the quality of our care to our veterans doesn't lag that of the private sector. And though we don't talk a lot, that's not our big role, isn't box two. Box two is that ability to transition from the future state where you want to go. You have to let go of some things that you've held on to. A good example for that is our transition to a modern electronic medical record. Our electronic medical record nationwide started in 1977. So we were the first to have an electronic medical record. That is now, it is command line based. They've had some overlays, but we realize now that that is one of those box two things. And we're in the transition to Cerner as our medical record so that we can integrate with the DoD. That's a good example of that box two and how we are promoting this concept of we're going to be an innovative culture and an innovative agency within the federal government. How we do the discovery and design work for our accelerator and what you can anticipate when you partner with us is based off of human-centered design. Its roots start from IDEO, which was one of the partner design firms that started with early Apple products. And it is ethnographic and qualitative, and it seeks to understand your customer specifically in the specific case, so that when you know and solve specific problems, that will later be generalizable. You as a startup would understand you have to pick your target segment and you have to solve a problem for a target segment. And then once you solve that niche, this is more of like Clayton Christensen's innovator's prescription kind of perspective of like the disruptive innovators are the ones that find that niche market and then they grow. So Amazon did not become like the behemoth it was because it was going to be just a bookseller, but it solved that niche, right? And that's how they grew. And Facebook was just a social network, but it grew but first they had to really conquer that target segment, which was like, of course, a social network for college students, but it grew from there. So I'd like to highlight a couple success stories of partnerships with the VA. And the first one will be Podometrics. There's a great video that I'm going to show here. And so listen and enjoy.
The VA is the largest integrated healthcare system in the country. We serve over 9 million veterans, 52,000 patients with diabetic foot ulcers that we treat every year. It's a $3.2 billion problem and a devastating problem for the veterans who experience ulcers and limb loss.
I could lose my legs, I could lose my feet, and I appreciate what the VA is doing here to help me stay on track.
One of the really exciting things about the VHA innovation ecosystem is our ability to be agile. Through the programs that we have that have developed over the course of many years, we have an operational infrastructure for innovation that spans across the entire enterprise.
The ecosystem really centers on some core principles, and one of those is strategic partnerships, recognizing that VA cannot do innovation or innovation healthcare alone. We have to have a robust ecosystem, which requires us to partner with folks in the private sector.
We have 39 medical centers where we have innovation directors and innovation programming, where we leverage the insight and the feedback of veterans and their providers in designing and developing new solutions to improve care. Podometrics developed a solution to this problem. I wanted to explore further what that would mean for veterans in the VA. We pulled together this team of key stakeholders, the director of the Prevention of Amputation for Veterans Everywhere program, chief podiatrist in the VA, a number of researchers and clinicians, the director of health equity, and we launched the initiative to end diabetic limb loss. And we did this by navigating the organization, overcoming challenges, barriers, and streamlining the care model that would incorporate remote temperature monitoring into the prevention of amputation care for veterans.
Podometrics has developed a virtual care support system for the prevention of diabetic amputations, probably one of the most devastating complications of the disease. The system has two parts. First is an FDA-cleared smart mat that users just steps on for 20 seconds a day in the comfort of their own home. It doesn't require internet or a smartphone to use. And the second part is the remote monitoring team that then works with VA clinicians And if we see any signs of developing wounds or problems in the foot, we can begin care earlier, so it's simple preventative care as opposed to more extensive treatment care.
I think veterans are incredibly vested in their care. They're vested in the long-term sort of value proposition as we think of it. They want to remain functional to the best of their ability. So these are individuals who are engaged and they are willing to adopt new types of technologies or new modalities of care delivery if they believe it will enable them to have a more fruitful and productive life.
It is a long video, so I'm going to sneak ahead. I think that was the thrust of what I wanted you all to see from it. And we have another example. Again, we have Susan Shirley will be on the call to answer questions about her experience with that. Another more recent product was portable parallel bars that allow in-home physical therapy to do additional therapy. And that is happening. It is a partnership with Wearology, and it is being piloted out of the Richmond VA and Catherine Beckner is here to answer any questions you might have with that. The goal is with that partnership was to obtain feedback from the physical therapy department that will impact the evolution of that product design. The next iteration is planned to be trialed at the Richmond VA this fall. And in this particular case, the investment looks like a purchase of 2 iterations by the VA, time, resources, and expertise of the participating INET sites and clinicians. Earlier, I had mentioned that the network started as an internal facing organization. Our premier kind of intent was this year-long accelerator. With the relationships we had in place, we saw an opportunity as we started meeting and interacting more with innovators from outside and in the private sector. And so in the last year, we recently formalized this into another premier offering from the network, which is called the Greenhouse Initiative. The Greenhouse Initiative can help a startup, a private sector startup, in 3 particular ways. One, we can support brand new concepts and solutions with a goal to develop a functional prototype. You can share early stage product designs for end user feedback. And you can conduct small scale product feasibility testing, like user experience testing, with appropriate end users to collect feedback. Some frequently asked questions about the greenhouse. How does the greenhouse intake process work? So there's a link, and you'll have a copy of this presentation, and you can click on the link. You'll apply and fill out the form, and you'll get a response within 10 days. If accepted, you will pitch to the network of innovation specialists. So my peers and Catherine Beckner at the 32 to 34 other sites in the US. The reason that's an upsell, I think, to me is that instead of going through the local bureaucratic politics of a single site, you have a lot more opportunity for success because you can go multi-site. And I know Dr. Bailey, when she joins, I know she's helped with multi-site launches for partnerships with startups. But it really is upon you, once you get accepted, to frame your pitch in a way that is appealing and recruiting other innovation specialists. If you apply, you can always contact me, and it's a win-win for the veteran. So it's in my best interest to give you the best opportunity in coaching for pitching to our audience, so you know who you're pitching to try to recruit as many people as possible. Once they sign up, we'll set up a kickoff, and we'll organize things further from there. Second common question: is funding available for potential prototypes? There are lots of maybes on this. There's lots of for instances. So I would say the answer is yes, but with conditions on a case-by-case basis. The last question that commonly comes up that I'll talk about will be about intellectual property. So if you partner with the VA, and there's a lot of details on here too that aren't going to be answered in this particular slide deck, but it's worth just, you can reach out to me and we'll get some more details to you. but it'll be a contractual relationship you have as a partnership. So you'll have some type of statement of work. Depending on how things go, it might be appropriate for you to have a CRADA, which is a I'm sorry, now it's escaping me, the acronym, but it's for research and development agreement. So it's like a cooperative research and development agreement. So if you're working on something together, it spells out who owns what and where that goes. So some stages of the collaboration require no legal agreement, but acknowledgement of the collaboration is appreciated. And the VA will likely not seek rights to the product, but could, for example, make an agreement in regard to products which might be eventually sold or licensed back to the VA. Kind of makes sense. Like if there'll be, again, it's really just contract negotiation of what will be the upside for both participants in the contract. So you might see like we might have a reduced cost if we buy the product from you once you've developed it. So there's a lot of that is just completely negotiable. But if you have any further questions, we can get back to you on that. The last thing I wanted to highlight is the VA Innovation Experience, which is happening this coming week. And if you are in startup land, you'll be familiar with demo days. This is the VA's demo days. And I'm really proud to have been involved with these, with demo days. It is a collaboration. It is an opportunity for our accelerator members, again, that competed to present and competed to share their products and solutions. So it's their chance to pitch. It's also an opportunity where we bring in, it's done at the National Press Club in Washington, D.C., and the media is there and other established companies are there too. So it could be an opportunity for you to get exposure if your ultimate plan is acquisition or licensure. That is an upsell too that we don't hear a lot about, but that's an opportunity for you to get exposed to larger name brands like Form Labs and some other tech companies. Let's see, just a quick overview of innovators' experience.
This is about telling our story. And I think it's sort of eye-opening when you hear some of the comments from Innovation Experience is people to sort of say, VA's really doing that? And what better way than to show them?
Coming here reminds me of who my family is, renews me, reinvigorates me, and gives me that energy I need to go back and fight the hard fight of innovation.
It's just really thought-provoking. And there's just a lot of things I think we're learning that we can help, diffuse to our own networks.
The Innovation Experience is a gathering of incredibly brilliant, incredibly resilient, and incredibly passionate VA employees, along with their academic and industry partners that are designing solutions in real time to change and save veterans' lives.
Well, that concludes my presentation. On the line, we have Catherine Beckner, I see here, and Dr. Bailey is here. I think Suzanne might be on. I'm not sure if anyone can speak to that.
Yeah, hey Eric, I'm on.
Okay, Suzanne's on, and I am here too. So let's like to open it up to any questions that you all might have.
So I'll start off not with a question, but an observation with from somebody that's worked with the VA for a number of years. My name is Scott Bolte. I'm one of the co-founders of HealthTechMKE, and I'm delighted you're all here. And my observation is from my work I did a number of years ago. And it was that the VA is not just large, but they are fundamentally different than any other organization in the US. And that's because the patient's interests, the healthcare provider's interests, and the payer's interests are all aligned. Everywhere else is a disconnected 65, but the VA's mission is such that they have their patients until they die. And that's a good thing. I have seen it personally. It is expressed in more proactive interventions to try to avert or postpone the onset of disease. So diabetes, for example, many other providers, if you're 60 an intervention that will help in 7 years doesn't matter because you'll be after 65 and somebody else will have it. So I encourage everybody to take advantage of this opportunity. It's an excellent organization. And like I said, they are unique in the US in that they are proactive. And I think this innovation initiative reflects that. So thank you all for joining.
Thank you very much. If you'd like to just, if you are shy, you don't want to be on camera, you can enter your question in the chat as well. And that way we have a record and we can follow back up with you potentially.
Eric, this is Mike. There's a question in the chat about, are there specific areas of focus? Anything that like substance abuse or patient engagement? Anything that the VA specifically focuses on?
We have our own, and I'll open this up to, actually, I'll tell you what, I've already done a lot of talking. I'll open up to the panel first. And Catherine, Susie, what do you think? What are some focuses? Well, the challenge, by the way, I'll just say is we don't want to be restrictive. Like it's contrary to our whole point. So we don't want you to think that there is not a place for your innovation in the VA if it doesn't fall under here. But we do have, of course, focuses.
Yeah, I will say, especially with the greenhouse and all projects, really, we have so many diverse medical centers that we try and really intentionally match our projects with the most appropriate medical centers. So if there's a project that's specifically focused on physical medicine and rehab, that may come to Richmond. You know, we have a large physical medicine and rehab program, National Centers of Excellence in that area. If it's something very specific related to 5G, that may go to Palo Alto. They're a leader in that. But that doesn't limit the number of medical centers or the medical centers that can participate. So just because Richmond may lead physical medicine and rehab projects doesn't mean there aren't veterans with physical medicine and rehab needs throughout the country. So we try and combine the centers that are large and established in those areas with centers with a variety of patients, potentially rural health, you know, whoever that may be, so that we can get diverse perspectives, so that we can say, you know, this worked in Richmond. Let's see if it works somewhere else. These are our needs here. What are your needs there? So we do try and intentionally match that. And the focus is, we also have, you know, specific areas of interest for the Spark Seed Spread program that we seek applications every year, but we try to be as inclusive as possible, trying to find solutions that are meaningful to veterans in the healthcare system. And then to the other part of the question with the decision-making factors related to the greenhouse model and transparency within that, the decision-making process is it relevant to the VA? Does it address a problem that we may have? Can we get it out there and see if it's something that relates to the medical centers within the Innovators Network? And the transparency to the process, I want to answer that question, but I want to know what that means. We try and be very transparent with our agreements that we create to work with you throughout the process. Very transparent and ongoing communication and documentation throughout. So I hope that helps. If anybody wants to add.
Yeah, Catherine, that was great. This is Susie, and I just want to thank the group for the opportunity to present and share about our work today. Eric, you did a great job, and I think, you know, Catherine, you really hit on all the important areas, I think, in terms of priorities. But, you know, I just also want to reiterate that the way that we engage, you know, and support and develop different innovations really relies a lot on our, you know, continuous ability to seek, you know, understanding and insight from both our veterans and our providers on where the problems are and what the solutions might be. So we do have a breadth of, you know, different topics that we address in our portfolios. Of course, mental health and suicide prevention, caregiver support, you know, areas like that are of, you know, particular interest to the VA as, you know, as strategic priorities moving forward. But the way that we measure the success of any innovation, and this enables us to determine what should be advanced and what shouldn't, is really clinical outcomes and economic outcomes. So when we can improve, you know, patients' lives and we can avoid cost, then those are typically innovations that we continue to support and advance and scale, regardless of the particular area of focus. But given that, Anne, do you want to speak a little bit to what those 4 focus areas are moving forward related to solution topics and where we're building communities of practice across the country?
Yeah, sure. So we've got different growth lanes that we're really focusing on over the next year and in the years to come. Immersive technology being one. So that could be focusing on employee education, simulation, and training, or it could be veteran-facing solutions where we're actually engaging veterans with different opportunities. There's also data analytics and data transformation, where we're trying to democratize data and make it more available both internally and externally. And digital health as well. We want to make sure that we are leading and learning from the ever-changing landscape of digital health solutions and wearables and smartwatches and applications and different things like that our veterans are using in their day-to-day life anyway, and maybe some that they would use more if they were aware of the availability. We want to engage those as well. And then Cerner, as I'm not sure, Eric had to join a little bit late. Today's a travel day for us, so we're all trying to do the best we can. But how much you talked about Cerner, but also continuing to think ahead as we roll Cerner out across all of our medical centers and how we innovate in that space as well. I see some questions in the box about Cerner. Eric, I'm going to let you take those.
Sure.
You're more familiar with all the ins and outs of the Cerner applications.
Sure. For those that are joining audibly, and sorry for those that we don't have closed captioning set up yet, but we will find a way to get you the information one way or the other. So for Cerner, at the last demo days, they did a presentation, and from my understanding from what they said, that the architecture for their EMR is based upon assimilation of medical EMRs instead of kind of transition over to a different EMR. So I would imagine the question, actually, I should read the question. The question was, does Cerner have an app orchard like Epic, some type of API channel for developers? I would anticipate they do. Our earliest pilot site has been on Cerner for, I think, over a year. And I can start asking the questions within our network and see what answer I can give you. I will say, kind of like what Dr. Bailey mentioned, is that right now our challenge is shifting 170 individual instances of a medical record over to our legacy system over to a new modern EMR. So I'll look into it for sure. My only other comment I would say is that there are some things that the VA is focused as their unique value propositions. So partnering with that would be very appealing, but by no means is it the only thing that we're interested in. But the VA does recognize in their unique space, amputation, prosthetics, PTSD, traumatic brain injury, suicide prevention, let me see, mental health, spinal cord injury. These are some things that we do very well because of our unique population and because of what we've invested in that. So, and rural veteran health is actually, I'll just plug for that. I know that right there is something we're very passionate about, is being able to serve our rural veterans that aren't, rural veterans. All right, is there another question?
Hi, this is Kyle Jansen. I've got a couple of questions.
Sure.
Thank you so much for your time today. I'm the director of the UWM Prototyping Center, and we work with a lot of front-end startups who have ideas, and we like to be able to make connections for them, as well as I'm an entrepreneur on a medical device startup myself. So my two questions are, what is the timing to have the entrepreneurs I meet reach out to you? Is it from, hey, I have this idea? And basically, maybe you could just describe the application and what's needed for that. And then secondly, if selected, what is the relationship like, and what are the resources that are provided for the entrepreneurs And maybe if someone could explain, I heard how a special blood pressure cuff was developed in terms of the customer discovery or research or trials or business planning and resources to connections. So that was a big old question, but
yes,
you could maybe just walk me through a specific story of start to finish a product.
All right.
Or a relationship.
Sure. I'm going to do a broad overview and then I'll let the panel answer because they have some experience with that. So broadly, the role that we play. So in our perspective of the framing of innovation, you have some common phrases, right? Everyone has their model. Our model is somewhat to this, and correct me, panel, too, because I've seen it from 2017 to now, and it may have evolved a little bit. But in general, we have discovery. So understanding and problem framing is the first thing that happens, and that is something that that is a goal of the Greenhouse Initiative. Is that we have some startups that are in that discovery phase, trying to understand what is the problem from the veteran's perspective. What is unique about veteran healthcare that could benefit from their technology or vice versa. Next, you have design. And so after discovery, we were looking at what are some user feedback is something that we really is something that you can do. We can look at developing a functional prototype, reviewing early stage product designs, and then feasibility testing too of what it would look like, at least on the small scale unit. So that is the design. The way I see it is the design frame of reference. Once you cross over to delivery, that's when there's really kind of a hard stop with what we do. Because we're not a private organization and one of our constituents is the taxpayer, we cannot give special, I'm going to try and reframe it from can't. Let's just say this. Our role is to promote this idea. There's a whole nother set of the government that is about getting you business and having your business interact with the government. And I can point you in that direction. There are just some things that we can't commercialize your product for you as a startup, but we can give you all the design support up to that point. But I can, and I have with some other Milwaukee innovators and inventors, pointed them in the direction of how to do business with and at this point, it's actually the federal government as a whole. It's not VA in particular. It's how do you get where to go to start this getting involved with getting on contracting, making it so that the VA hospitals can purchase your product. So that's kind of the distinction as far as timing, how that works. I just wanted to make sure to get that out there. It's just, even if you've already have your product and you're just trying to sell it, it's not necessarily the right, we should just talk over that. But I can probably give you some direction of where to go with that, because I think so long as it's benefiting veterans, I'm 2 thumbs up over here. Your question was on timing and on if selected the resources. I think I will defer that question to the panel and clarify. Go ahead.
If I could just speak to timing, like obviously before you go pitch to a VC group, you'd want a functioning prototype, you'd want some business interest, you'd want to have done all these things. But it sounds like somebody should be approaching your team very early on with, hey, I have this idea, I haven't quite flushed it out yet, and you would support with flushing that out.
Before I make a declarative statement, I agree a lot with that, but I'll let my expert panel give some more opinion on that. But that's kind of what makes sense to me. So, Anne, yes, I see you.
Yeah, I can speak to that a little bit. So
sure,
specifically for the greenhouse, yes, this is really the stage of early end user feedback. I know Catherine can speak to it a lot more as well, because she's had several projects that have gone through the greenhouse. Susie has a ton of familiarity with what's happening in that prototype building process. But yes, the greenhouse is very early stage development. We do have different opportunities across the spectrum for different stages of development. And so we're really working hard to build out that process and pathway to make it a lot more, make it a lot easier for people that are interested in engaging with with VA at different stages of development. You ask a question about what type of relationship, and that's the one part that I feel like I was probably really invited on this call to speak to, and that's the collaborative agreement piece. So Eric mentioned it, a CRADA, or Collaborative Research and Development Agreement, is what we generally negotiate for these types of product development and user feedback and things like that. It's basically an agreement that says we're providing our own resources. So VA will provide our clinicians, or our, access to veterans as appropriate, or data in some cases, different things depending on what you need for your particular product, process, device. VA will provide our resources and you will provide your resources, so mutual participation. No funds are exchanged. And then we set up a particular length of time for that agreement to last. We see a full gamut of how long they last, but we just need, again, that would be very individual to your project, what the goals of the relationship are. Eric stated it perfectly. One of the things that we have to know in entering these agreements is that it's beneficial to veterans and beneficial to the VA. We want it to be beneficial to you as well. So we want to be good collaborators and good partners. And in those agreements, we can negotiate intellectual property, as he mentioned. We can negotiate licensing agreements. We can negotiate data ownership going forward. So we have great relationships with the legal team here that are very supportive of this work. So I know sometimes people hear lawyers and they get a little nervous, and maybe lawyers plus VA makes you extra nervous, but we actually have a fairly short turnaround time if all things fall into place. We have a very supportive team on both sides. So just wanted to set those expectations as well.
Catherine or Susie, any comments?
Yeah, sure. I think Anne described it well. The greenhouse is a perfect fit for that early stage discovery. For example, with the parallel bars, the startup came from a maker challenge, and they said to us, like, we have this idea, we have this concept for helping folks get therapy when they can't get to the therapy gym. And because that problem resonated with us and the care that we provide to veterans, we said, you know what, I think we can do our end and provide, like Anne said, our own resources, our clinicians, access to veterans for feedback, and begin to design something meaningful together. So we have provided those clinicians, we've provided the feedback, and through this relationship, we also then provided a contract to purchase 2 of the initial prototypes that we designed. So every collaboration, every relationship, partnership is unique, but that led to these 2 prototypes that we've created together. Wearology has provided their own funding and they've sought funding elsewhere for the FDA approval process. And so I guess it goes back to every project just being very specific based on the needs of that project. But as Anne said, our goal is to help and provide as much as we can on the VA end of how it will improve care for veterans and our own expertise and what we've seen in providing that care, and partner with you in a meaningful way.
That's fantastic. And getting feedback is 90% of the battle during development. So that's great. Thank you, guys.
Okay.
Susie, I had something to comment, but I want you, because I hear it sounds like you're on the phone. So did you want to share anything before I mention something new?
Oh, no, that's all. I mean, Anne and Catherine and you have really touched on all the important pieces there. Yeah.
Now that since I have this audience, what I wanted you guys to understand too is something unique. And, this is my learning from joining the network in 2018. Before that, I was in medicine doing more Lean Six Sigma stuff. Everyone's heard of DARPA, right? And I've heard of DARPA, and they do amazing work. And you think of NASA too. So you can be leading and still be federal government. But one thing I wasn't aware of, that DARPA is actually one category of a type of institution with it that's a private-public partnership, and there's commercialization. And so there's an opportunity. This is not I'm not promising you this. I'm just saying, if you have an idea that you don't think is commercially feasible, this is really a reaction to, I think, the concept of like having to have a prototype for VC or for partnerships to invest in is we would connect you and we can start helping you form a relationship. There's a whole infrastructure for commercially non-viable good ideas, for things that are in the best interest of our citizens in America, but no business could front that. DARPA is a good example of what that, how that works, because we don't have, anyway, it just makes sense, right? But there are other organizations that are in the same category of what DARPA is, but and they're private-public partnerships that can create that relationship between industry and federal government to supply, so that the veteran doesn't miss out on something that's not commercially viable, but still might be a great innovation. So that's a potential, if you feel like that's an opportunity, or that speaks to you and your idea, please connect us. We're going to be about like finding the resources and connecting people and see where it goes.
Eric, I'm gonna go ahead and stop you right there. We're out of time actually, but that is a perfect time to stop, because you and I talked briefly before, and that is kind of what you just touched on right there, like further opportunities to engage with other government organizations. That is something that maybe we can talk about at a future event as well. So keep your eyes on HealthTechMKE.org, and we'll keep you updated. So first of all, I want to say thank you to Eric and our entire panel of experts. That was fantastic. I really learned a lot, and I really appreciate you being willing to come on out and tell us a bit more about the program. So before everyone goes, I'll just remind you that this event is part of Milwaukee Tech Week, and Tech Week continues in about 6 minutes is the virtual celebration event for the Milwaukee Tech Hub Coalition's 2-year anniversary. They're going to have Milwaukee Bucks Chief Technology Officer Robert Cordova speaking as kind of the keynote, speaking right at 1 o'clock. So the day is just getting started. So so please go ahead and check it out. I see Eric put his both email and LinkedIn in there, so I'll give you a couple minutes to copy that down if you want to contact him in the future. But thank you all, and take care.
Thank you. Thank you very much. Have a great week.
Thanks.